Okay, let's talk a little about cardiovascular disease. Excuse me. This is a big one. If you look at this, this is the #1 killer in the United States, accounting for almost 40% of all deaths. That's a lot of people. So understand that this is really important, not only it should be to you and your family, but to society in general, because a lot of what causes cardiovascular disease can be preventable, or at least we can get a hold of it and control of it, and we can reduce the amount of deaths caused by cardiovascular disease. So there's a huge cost to our society, about $555 billion. That's a lot. They think that by 2035, if we don't get control over how we eat and the foods that we eat and things like that, can be over $1 trillion. So it's a lot. It's a big deal. We're getting better to treating cardiovascular disease with CPR. We've got AEDs now that are available. We've got really good drugs. We educate people. So we're doing a lot of good things, but we're still way, way behind. And you'll see a video a little bit later on that talks about that, and you'll see we've got a ways to go. So for more information, you can go to millionhearts.hhs.gov. So we need to understand a little bit about the cardiovascular system first. So your heart is just a big old pump, and it's going to pump what we hope is oxygen-rich blood through your system in order to keep your cells healthy. We keep those. We pick up that oxygen from the lungs, and then it circulates through the body. And basically, our heart's rhythm is maintained without us consciously trying to maintain it through something called the sinoarterial node, or the SA node. And that's basically the pacemaker of the heart. When that doesn't work very well, or if that fails, we can actually get a pacemaker that sends the signal for us. Now, our brains can speed that signal up or slow that down. So we can make it faster or slower. Our brain's receiver can send out a signal. But the SA node is just going to keep that beat going for 100,000 beats a day. So this is what that looks like. The blue is non-oxygenated blood. So that typically is running through veins, except for one vein called the pulmonary vein. A vein typically carries unoxygenated blood, except for one instance, the pulmonary, and it flows to the heart. Okay, so it's bringing blood to the heart. So if you're going to see blood going to the heart, it's in a vein. Arteries take blood away from the heart, and there's only one artery, of course, that doesn't have oxygenated blood in it. Everything else is oxygenated, and that's the artery that's going to the lungs, because it hasn't picked up oxygen yet. So if you follow this little flow chart, little picture here, you'll see that it's going to enter into the right atrium. And now, for those of you who are going to get into anatomy, you have to understand that when you're viewing the picture, it's always you. So this would be your right side. So you've got to flip that heart around. So right atrium into the right ventricle, out to your lungs, back into an atrium, in this case the left one, into the left ventricle, and then out to your body. So follow that flow pattern there and make sure you understand where the blood is coming through. So where the white lines are on that is the muscle around the heart, and that's the pump. Okay. The sound that a heart makes, that lub-dub, 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 that you can hear, that's the valves opening and closing in the heart, allowing the blood to pass through, but not to come back into the chamber. So we want it out of the chamber. So that's the valves opening and closing. That's that lub-dub, lub-dub, lub-dub that you can hear when the heart is beating. So that's just a quick overview of what the heart does. I'm going to get on with this slides, but you can keep looking at that. So you can pause this and kind of trace the arrows and see where they go and read where it's going, and that's going to be pretty important. I think it's important to understand the flow of our heart, and that it's a pump, and it's bringing blood in and it's shooting it out. Just like what I said, arteries are carrying it away, veins are carrying it too. The exchange between an artery to a vein happens way down at the cellular level, at what we call the capillary level. So the capillaries are going to feed down into the individual cells or surrounding individual cells, and that's called the capillary bed, and that's where the oxygen is transported into the cell. The blood then flows or picks up material, carbon dioxide, and then brings it back to the heart through the vein. So that happens at the capillary bed. So that's where that transition. So it's a closed system. It joins one another. It flows from artery to vein, and it does that at the capillary level. The capillaries are where we run into problems, right? So when we talk about arterial sclerosis and stuff, it's usually occurring down at those really, really small diameter areas of the vein in the capillaries, and that's usually where the blockages are occurring. And so that's where we have to be careful. So this video is going to talk about heart disease and give you some facts on it. It's done by a British company, so it's pretty interesting, and you should be able to see that on in your video material. Okay, so here's some types of cardiovascular disease. You can go down the list. We're going to talk about each one of them individually. So there's the list, and now let's hit each one off individually. So here's arterial sclerosis. Now, it's a type of arterial sclerosis, and basically it's fatty deposits. If you listen to my nutrition lecture, I kind of talked about this already. The saturated fats from animal fat basically is sticky, and it'll in our veins and arteries, they have a lot of pressure behind them, so they're expanding and contracting, and as we age, we're going to get little fissures in there, which are little tiny cracks, and it's just normal, natural stuff. But if you have these fatty deposits stick into those cracks, and then they kind of keep sticking onto each other, then you're going to get a blockage. So that's not a good thing. We don't want blockages in our veins or arteries. So that's the buildup of plaque. That's arterial sclerosis. And basically, the high blood pressure causes these little fissures. The high cholesterol and elevated low-density lipoproteins, or LDLs, cause the sticky fats to stay up against the wall, like you see in this picture. And then you have different materials and waste that are flowing through that stick to that fat, and then it slowly builds this blockage, and then obviously then we can't get the blood flow through. You can also inflame this artery or vein because of a disease or a microorganism too can inflame it, so it just makes it irritated, and it will also make it more sticky. So that's how arterial sclerosis kind of occurs basically. The fat sticks to the wall, and it sticks to the wall because of either high blood pressure or some irritation to the wall that allows it to grab onto a little fissure or crack in the side of the vein. Coronary heart disease is the single greatest killer of cardiovascular disease, and heart attack is the common name for this, or the medical term is a myocardial infarction. Myocardial is heart muscle. Infarction means either irregular or death. So basically, because the oxygen didn't get to that muscle is not contracting, so all the muscle around it has to, and it gets into an irregular rhythm or no rhythm at all. So that irregular rhythm doesn't let the heart pump, right, in a normal beat. So it's kind of, does this weird little, and so you're not getting the same circulation pattern. Oxygen is deprived, and then we die. So, or it doesn't pump at all in that section, so you're not getting any good push out of our heart doesn't pump, and we die. So that's why heart disease or heart attack is so such a problem. So typically we have a minor blockage, and we can feel that. We'll talk a little bit about some of the symptoms of that. So because it's a blockage in there, and we're depriving oxygen, we're going to feel it pretty quickly. It's that chest, it's pain, it's the heaviness on the chest. Guys, we're going to feel it down our arms. Ladies, not so much. Sometimes in your neck. Ladies, you're going to feel a little lower. But within the first hour, if we can get you help and break up that clot, we have about a 40% or a 60% survival rate. So if we don't, the first hour is really important. That's where we get about 40% of our deaths. Now, that doesn't mean that you're going to guarantee to live. If you live an hour, you're going to guarantee to live. It just means your chances are better if we can get you help within that first hour. Angina pectoris is chest pain. So that's that circulatory impairment that I was talking about. A lot of times we can give nitroglycerin that helps relax the vein, and it reduces the pain. If it's a pretty chronic kind of thing that you constantly get this angina pectoris. We can give you a calcium blocker to slow your heart rate, or a thing called a beta blocker that keeps your SA node or keeps the rhythm, keeps your brain from overriding the SA node. So you can only get so many beats per minute. This is really important, especially if you work in a clinic and you have patients who are on a beta blocker and you're trying to work them on a treadmill or on a stepper. Their heart isn't going to beat any more than what that drug is regulating out. So if their beta blocker is setting them at 60 beats per minute, you're not going to get them to 65. Chemically, they can't do it. So you have to be really careful with beta blockers. If you're in the healthcare field and you're a physical therapist and athletic trainer, you'll nurse, doctor, you'll learn about beta blockers. So these are some ways that we can kind of help with pectoris angina or heart pain that when it becomes chronic. Arrhythmia is an irregular heartbeat. You can get tachycardia, which is too fast, or bradycardia, which is too slow. This can lead to congestive heart failure. You can have an arrhythmia because of a poor valve as well. So if the valve's not closing all the way, or if the valve is a different shape than it ought to be, like it's a bicuspid or a 2-valve instead of a 3-valve, you can have an irregular heartbeat with that too. It sounds different. Remember, the heartbeat, that lub-dub, 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 is the valves opening and closing. Lub-dub, lub-dub, lub-dub. So if you can hear it and it's irregular, you have either a problem with the valve or your heart's beating too fast, so you got a real fast lub-dub, lub-dub, or you're real slow lub-dub, lub-dub. You can practice saying lub-dub too if you want. Anyway, that's arrhythmia. Congestive heart failure occurs when you're not getting good circulation. You're either beating too slow, your heart's not very strong, you have some backup in the valves not closing all the way, so you have some regurgitation of the blood flow back into the chamber it's trying to push out, right? So try to pour a cup of water out and then put your hand against it and force it back into the cup, and it just makes a mess. Well, the same thing happens with your blood flow. So we're trying to reduce fluid with that, so diuretics help. You can get something called a digitalis, which increases the efficiency of your pumping heart. Vasodilators, which makes the vessels bigger, that allows more blood to flow easily. So there's ways that we can fix congestive heart failure, but typically they start to retain water, and you can have kidney problems, and congestive heart failure is a rough way to go. So we want a good, strong, efficient heart, so we have to take care of it. Different reasons we can have congenital heart disease, which is just a kind of a chronic disease where your heart is kind of weak and it can lead to congestive heart failure or other problems. You can have had a fever when you were in your mom's womb, before you were born. Your mom could have had a fever, and rubella will do that to you. Or you had rubella as a young baby. Chemical intake while pregnant can do that to the baby. A rheumatic fever, where the antibodies to kill the rheumatic fever attacks the heart. So there's different reasons why you can have a weakening heart that causes congestive heart failure, and those are some of the reasons right there. So it's not always something that we do because of what we eat or lack of exercise. Sometimes it's something we're born with, or an infection of some kind that causes our heart to weaken. Stroke is a really tough one. It's also called a cerebrovascular accident. And it's when the blood supply is cut off to the brain. So basically your heart's pumping fine, but you've got a blood clot or arteriosclerosis up in one of the vessels in your brain, and it cuts off oxygen to that part of the brain, and that will cause cellular death or brain death of that section. So depending on where that death is, you'll have a different function. So if it's in the right hemisphere, you'll have a left-sided deficit. If it's in ocular motor where your eyes are controlled, you won't be able to see very well. Or some people lose the ability to speak, or any combination of those things. So it can be caused by different types of clots. So a thrombus is a blood clot. It's just where the plaque is built up in one section and then it stays, and then the blood gets cut off, the oxygen gets cut off from that point. An embolus is when you have a clot that's formed, it breaks loose and then drifts down into a narrow passage and then gets stuck. And so that embolus, or a wandering clot, is dangerous because it can block off that spot, kill that part of your brain, and you get a chemical that they give you a shot, and it frees it up and it slides down further and kills off another part of your brain. So an embolus is a tough deal, so we don't want one of those. An aneurysm is a weakening of that vessel, and it causes it to burst. So an aneurysm is nasty because then you can't repair that, and you can't get rid of the clot. It's just broken. So anywhere that blood was taking oxygen is no longer delivering that oxygen. So everywhere, it's a nasty one to get, and That's the huge ones. That's the big strokes typically, where they lose left-sided function and the ability to speak or see and things like that. So stroke is really, really tough. I've worked with a lot of stroke patients when I was in clinic with the physical therapist, and it was really, really tough on those people and their family. So if there's one reason to take care of your heart and to take care of the circulatory system, it's if you want to have one reason, it's stroke. So some warning signs: sudden weakness, numbness to the face, leg, or one side of your body. Remember, it happens at your brain, but it's going to affect one side or the other, unless it's a midbrain stroke, and then that's a whole different ballgame. But usually it's one side or the other. Dimness or loss of vision, loss of speech, sudden severe headache, that's a big one. Dizziness. So those are the warning signs of stroke. Remember, heart attack is different. Heart attack is chest pain. You might have some pain. You may get some stuff into your hand, but that's typically centered, and painful. Strokes are going to be more neurological, where you're going to have weakness and numbness, and vision is starting to go blurry, and speech impediments because you can't move your tongue or whatever. So understand that stroke is going to affect the brain, and so you're going to have those symptoms that stem from that. So ways to control cardiovascular disease. Well, quit smoking. Just quit smoking. The nicotine is what's doing it. We used to, the whole idea with smoke was that it was the tar and blah, blah, blah. It's the nicotine. It's the nicotine that causes our heart to stress, causes the circulatory system to go under stress, causes those little fissures or cracks in their inner wall of those vessels, and then, poor diet or whatever. So make sure that you quit smoking, and that includes vaping. No more nicotine. Nicotine, especially if you have a family history of you have congenital heart issues or you have a family history of heart disease. Don't put any nicotine in your body. So you can also decrease your fat intake. You can make sure that you're getting good fats. You want the high density lipoproteins. You want to increase your exercise. You want to drink or consume things that are high in antioxidants. All of that will help lower the bad fats or the low density fats. So you can read through that again, ask questions on that, but basically that's what you need to do. Obviously losing weight will really be important. Different body types, like the apple versus the pear. So android or the apple is more dangerous because more fat is laid around the chest or around the heart as compared to the pear. Here's the bad news. Everybody's going to get the apple shape. Women tend to be pear shape or gynoid, but after menopause, they produce less estrogen, and so fat starts to lay down like men in their abdomen and chest, and so we all eventually get to the android look, and that's dangerous around our heart. So controlling our weight, eating good is important. Obviously, diet. Fiber in your diet is important. Increasing your physical activity is super important. Making sure that you're having moderate levels of exercise. Excuse me. Managing your stress. We talked about that in this class, and that's really the whole big ball game here. If we can control our stress, then we're going to be better off. So remember not to procrastinate, set good goals, make sure they're reachable goals, be around people who tend to be happy and that you make them happy, and they don't cause you stress. So lowering your stress is really important. That affects your blood pressure. So control your stress. Lots of factors for it: heredity, age, gender, race. Blacks have 45% greater chance of hypertension and heart disease. They think that has a lot to do with diet and stress. Men have an increased risk over women, although those numbers are getting closer together because we're better at picking out why women are having heart attacks, and we're taking them more seriously, basically. So since '84, more women have died than men because of a heart attack. They've had fewer, but more women die than men. A lot of that has to do with the symptom of it. It tends to feel a little bit lower, like gas maybe, and so doctors were less likely to say, oh, a heart condition. They're more likely to prescribe some sort of antacid or something like that. We're better at that since the mid-'80s, so we're better at that. Hormone replacement therapy isn't a wise choice because there is a risk to cardiovascular disease with hormone replacement therapy. Because the idea is if we lose estrogen, then your chances go up. But replacing estrogen shows that it doesn't really help. So just good diet, exercise helps a lot, decreasing stress. So this is a good video on women and heart disease, and I encourage you to watch this. Check it out. So lots of different things that we can do to see whether to test for the heart disease and what exactly is wrong with our heart. So if you have a regular rhythm or what have you, or if you're having chest pains, they can do lots of tests. And here they are: electrocardiograms, angiograms. I mean, if you want to look at these things, here's the bullets. Just Google these things, and they'll actually show you pictures and how they work. But the surgeries, you can go on YouTube and see these surgeries, so it's pretty cool. So there's lots of ways that we can treat for cardiovascular disease. They talk about an aspirin a day as a preventive strategy. If you can tolerate it and your doctor prescribes it, it might be a good idea. It just thins the blood out just a little bit. Thrombolysis is an injection that you can get that dissolves the clot. So that's been really, really cool to be able to give people. Remember, it has to happen pretty quick. So the sooner you can get help and realize you might be having a heart attack or a stroke, the better. So that's it, guys. Ask any questions, let me know, email, text, and get on with your discussions and your assignments.